Good afternoon, and thank you for joining today's webinar on 340B Drug Discount Program. This session will begin promptly at 4 p.m. Please note the handout section on your control panel. There, you'll be able to download today's presentation and the 340B questionnaire template. Questions on today's webinar can be asked through the chat function of the control panel in this webinar. We would love for you to participate in our live word cloud activity today. Please take out your cell phones and text COVID-19 heroes to 22333. That's texting COVID-19 heroes to 22333. Today's live word cloud polling activity is, in one word, what does 340B represent to your health center? So in one word, what does 340B represent to your health center? Join HCN and Alliance Chicago for our first joint virtual education conference on November 4th through November 12th. Haven't registered yet? Simply scan the white QR code on the left-hand side of your screen. Good afternoon, and thank you for joining today's webinar on 340B Drug Discount Program. This session will begin in 2 minutes. Please note the handout section on your control panel. There, you will be able to download today's presentation and the 340B questionnaire template. Questions on today's webinar can be asked through the chat function of the control panel in this webinar. Once again, thank you for joining today's webinar on 340B Drug Discount Program. This session will begin promptly in 1 minute. Good afternoon, and thank you for joining today's webinar on 340B Drug Discount Program. The session is now starting. I'm going to hand it over to Alex Romeo, our CEO.
Thank you, Stephanie. Good afternoon and welcome, everyone. It is a pleasure to serve as the President and CEO of Health Choice Network, the first health center controlled network serving our health centers and safety net providers now for over 26 years. I wanted to thank all the health centers and safety net providers, our healthcare heroes, for their tireless efforts during these very difficult times. I wish I could see your faces. It's hard to go through these tough times and not have that health center interaction, but I hope you're all doing well and healthy. HCN, the Alliance Chicago, and many of our PCA HCN partners across the country actually started a free webinar series during the beginning of this pandemic back in March. This is actually our 13th webinar series. And the idea behind the webinar series was to share promising practices across all our health center and safety net providers and educate each other on what we can do to serve our communities during these very difficult times. Today's webinar is actually an ad hoc series. It's really focused on the 340B and the partnership between Health Choice Network, BKD, and all our HCCNs and PCA partnerships. Before I introduce the amazing team at BKD, led by Jeff Allen, and our HCN team, led by Margarita Olette and Rick Fradfeld, I wanted to give you the why. Why are we doing this? Well, HCN serves health centers across 23 states and works on different various parts of the country. And every PCA, every HCCN, NAC, HRSA, the Bureau, and some legislative officials were trying to capture data around 340B and the attack on 340B that we are currently under. So we thought that we can jump in there and assist. Well, every single entity was asking different data, requesting different elements, and then the data wasn't being able to be used as it was intended. So I picked up the phone and I called our partner at BKD, Jeff, and I said, Jeff, I have a crazy idea. Could we develop a template that would be simple to use, be able to capture the information, help us balance the information and compare the information with the amazing tool that BKD has built called Pulse, which has all our history of data across UDS and other information, and be able to give the health centers a one-pager that they can use with not only their own organization, their board, their staff, their state, their HCCN, their PCAs, but also all their legislative officials. It is critical that our legislative officials understand the impact of 340B, not only in their state, but in their voting districts. So many of our health centers, and I personally want to thank Miami Beach Community Health Center, Dr. Mark Rabinowitz, Broward Family Health Centers, Rosalind Frazier, and so many others that helped us develop this tool and pilot this tool, because it was interesting what tools and what data is available to you easily versus what data you have to go out and actually find. We also realized this is just one tool. The attack on 340B and some of the good news shared by our great partners at NAC understand that this is just one tool, but we hope that this is one big tool in our arsenal. One of the lessons learned during this process has been our health centers need to be able to capture their financial information, restructure their GL, and the reporting tools so when attacks like these happen on critical programs, we can respond timely and quickly. So without further ado, I want to introduce our great partners at BKD. Jeff Allen and the team have done an enormous job, and he's going to introduce his team. But we do have a saying here at HCN that we are definitely stronger together, and we are definitely stronger with our partners at BKD. Also, I want to remind you that in the Go To Webinar section, there will be a question and answer session that you'll be able to pose any questions you have. Our amazing tool developer, Ingrid, which will be walking us through this, will be able to take questions and answers during that time. And also, we've added in the handout section 2 handouts. One, this PowerPoint presentation, and number 2, the actual tool to be used. Our hope is that health centers and safety net providers will submit the tool to the email that's provided, hcn340bsupport@hcnetwork.org. We'll collect that information and return to you a one-pager that you can use. In addition to that, we hope to be able to give statewide data to our amazing partners like FACT here in Florida and other PCAs that we work with across the country. And we are making the tool, the webinar, and all the information available to all health centers and all safety net providers across the country because we are truly in this together. I also hope that you find this very informative. You ask a lot of questions. So Jeff, you want to take it away?
Thank you, Alex. I really appreciate it. And we are just really excited at BKD to be able to partner with HCN. I mean, we've been big admirers of what they do and how they can take care of their members and the information that they share and how they go about their business. So it's an honor for BKD to be able to work with them. When Alex called me and we discussed this and we really started thinking through the impact that some 340B potential changes might have on the industry, might have on individual health centers. It really was staggering to really kind of sit down and think about really what could happen if these things come to fruition, if we have some of the changes that are made, the loss of revenue, the loss of ability to provide services that might occur. And so we certainly started thinking through about what could we do to try to help calculate some of these things to really help health centers plan. If you add the federal grant, the CHC grant, you add state Medicaid reimbursement, and you add 340B, you put those 3 together, it's over 85% of the industry's revenue. I mean, that's the 3-legged stool that props up our program. So anytime there are changes to one of those 3 legs of the stool, that we have to pay attention to that. That is something definitely that we have to really think through. So I really don't want to spend a whole lot of time introducing because I really want to get to the tool. I really want to get to the presentation we have and who I've got with us today at BKD. I've got a couple individuals that really spend the majority of their time in 340B space. I've got Ingrid Brower, who's in our Chicago office. She used to work for a health center in Chicago, and she'll kind of talk. I'll let her kind of introduce a little bit more about herself. So she's really got some hands-on experience. She's really done this day to day and worked through that. And I also got a gentleman by the name of Brian Bell, who's in our Cincinnati office. And Brian actually leads BKD's services around 340B. So as I really, I lead our firm's practice of community health center practice across the country. But, I really depend on Ingrid and Brian when it comes to some of these 340B types of issues to really help educate not only our firm on what we need to be looking for in this program, but also our clients. And so without further ado, I'm going to turn it over to Ingrid and let her take away the presentation for today.
Thanks, Jeff. Thank you all for joining us on a Friday afternoon. With all of these changes coming through daily even, it's good to keep your eye on the pulse and see kind of what the actions are being taken step by step. So my name is Ingrid Brower. Thanks, Jeff, for the awesome introduction. I have background in CHC on the FQHC side with a 30 plus with an FQHC with 30 plus child sites and over 200 contract pharmacies. Also, I have experience on the retail pharmacy side with contract pharmacy compliance and inventory management. And I feel like all of these changes coming down the pipeline have just really put a lot of what we know into question now. So I'm going to do a recap on kind of the 340B program as a whole, a couple of the kind of the news stories that have come out with some quotes most recently on responses in the field or in the industry, and then go through the tool. So if we can jump to the next slide. Thanks. So the 340B drug pricing program recap, high level. To preface, this is a federal law requiring drug manufacturers to provide discounted drugs to stretch scarce federal resources. And that's kind of the tagline that it's known by. So stretching scarce federal resources. And as Jeff mentioned, many covered entities rely on 340B savings as just foundational to their day-to-day. And we at BKD are currently presenting and discussing these updates coming down the line from manufacturers, from NAC, from HRSA, trying to equip covered entities on kind of what they can do to strategize. And I guess my last note here with the recap of this program is it may be that manufacturers want to land themselves in court just to get a little bit more decisive action on what the 340B statute actually obligates from them. So what are the manufacturers calling into question? We have 4 or 5 manufacturers as it stands that I believe are calling into question the expanse of the 340B program, in part due to the use of 340B contract pharmacies. So it's that relationship that maybe manufacturers are asking, why should we consider retail pharmacies as an extension of your covered entity? In what way does that mean we need to comply by these standards? So covered entities are free to choose how they provide their 340B services. It could be in a patient setting, in their in-house pharmacy, or through contract pharmacy arrangements. And so it is that last bullet, contract pharmacy arrangements, that we know HRSA has stated in the guidelines is allowed, but manufacturers just don't, they're trying to press that and say, you know, why do we consider that an extension of your covered entity? And the reason here, in my mind, being in the space, is that overall, contract pharmacy does continue stretching scarce federal resources. By leveraging those pharmacies in your community, you see benefits to the patient and definitely benefits to the covered entity. So just to briefly go through what is at risk here and what the 340B program currently stands for is, on the patient side, that integration between pharmacist and provider, that communication and providing better care together is foundational to the contract pharmacy setup. It also can enable mail order, specialty, LDD access. And then the last 2 points on the patient side, I think go hand in hand. So if a patient has to pay less for medication, they may be more likely to fill it. So there's definitely that medication adherence component and quality metrics as well. On the flip side, with covered entities, for commercial claims, covered entities can realize those savings to then put back into their program and kind of build that better catalog of program services and overall reinvestment to your communities. Really quick, I wanted to list a couple of common medications, their maybe fill quantity, and then average out-of-pocket price versus the 340B price. You know, keeping in mind that there may be a dispensing fee, we see kind of a staggering difference between what patients may have to pay without insurance and without use of the program versus what uninsured or underinsured patients can realize from the program. And so since we recapped all of these benefits, on the flip side of the benefits to the covered entities, kind of the regulations go hand in hand. So BKD offers compliance, operational assessments, recommendations to our clients, and these are some of the components that we review in our standard processes. And one I wanted to point out and just touch on and dig a little deeper into is the duplicate discount component of the 340B program. So it may be that manufacturers are kind of using this as their leg in to question the program. And duplicate discounts are when the same unit of drug gets 2 discounts on it, one on the front side with the low cost purchased at 340B, and then on the end with the Medicaid rebate. So having kind of laid out the ground rules on what the program does, what it accomplishes, and I'm sure what you see in your communities as the benefit, I'd love to get into what exactly these manufacturers are calling into question and how that leads us to then execute the tool that we've put into the chat box. So recent events in 340B, it's these manufacturers, Eli Lilly, AstraZeneca, Sanofi, Merck and Novartis are still kind of up in the air on the extent of what data they're asking for, kind of their stances right now. But really, they are pressing the contract pharmacy relationship. They're calling for reform to clarify the 340B statute, and I think kind of pressing HRSA to say, okay, are you going to state your authority on this, or are we going to stop 340B pricing on these dates we've set? So all of these manufacturers have written letters to covered entities stating, on this date, we're going to stop 340B pricing to contract pharmacies. And the caveat with Sanofi and Novartis is that they are asking also for claims data. And while it is not necessarily uncommon to ask for claims data, what we're seeing with these manufacturers that is atypical is that typically, the claims data requests would only refer to Medicaid fee-for-service. However, these manufacturers are asking for all claims per manufacturer. And then just to touch on an executive order that came down the line on insulin and EpiPens, this impact was thought to be felt right away, when in reality, just recently, this executive order was recategorized as a proposed rule. So there will be a comment period, whereas we thought it was going to be an interim final rule, which would be kind of just, all right, this is effective. So definitely, while all of this is up in the air with what the manufacturers are asking for, many groups in the 340B space have responded. I've listed a few here only. And most recently, about 240 members of the House have written to HHS Secretary Azar demanding that drug manufacturers stop limiting access to 340B prices. So we've had kind of a whirlwind of responses and good traction here from all of these groups involved. And to add an additional level of complexity, I think, on this is pharmacies themselves have stated that if covered entities do provide data, they will be in violation of their non-disclosure agreements between the entity and the pharmacy. So while we're talking to clients, and I know Brian has been fielding a lot of these calls, our recommendations are to speak with legal counsel prior to responding and understand that HIPAA consideration of sending data with those non-disclosure agreements in place. And we don't quite know yet what it would mean to not respond. So while we wait kind of in this standstill moment, while HRSA gears up with a response, we did hear one piece of response from HRSA, and it's in that red box where it states they do believe that contract pharmacies serve that vital function in covered entities' ability to serve their patients. So I think that's a step in the right direction, but we still are missing that real final statement. And then
Ingrid,
yeah.
Ingrid, this is Brian. I just wanted to provide one update on Novartis. So we have heard here very recently that Novartis is backing off of not providing 340B pricing on October 1st if we don't respond. So that is good news. And I think the timing is interesting because that is the same day that they're scheduled to be part of a congressional hearing. And 340B isn't expected to be part of that congressional hearing. It's actually to discuss pricing for pharma, but it's just interesting timing that they are backing off of that claim that they will not provide 340B pricing.
Thanks, Brian. Yeah, as I mentioned earlier, these changes are coming really quickly, and Novartis backing off is just kind of one more news piece that we're seeing. So thank you. And last on the news front, I think, was an HHS letter to Eli Lilly, specifically kind of stating this underlined point of Lilly cannot and should not view the absence of any questions from the government as somehow endorsing their policy. So Lilly, by stating, you know, we're going to stop these prices, starting with Cialis, rolling out to all drugs, you know, HRSA is definitely stating that doesn't mean we endorsed it by not engaging in conversation with you. And then they go on to list 4 points in which the extent of their choices were concerning to HHS. So ultimately, that message is they're still assessing, but they did want to kind of check Eli Lilly there. So I'm going to take you all through the 340B program savings tool, which once again is in the handouts portion on the GoToWebinar attachments. And as we progress through this, I think I'm going to stop intermittently so Brian can maybe feed some questions out if we get them. And of course, as Alex mentioned, this is in collaboration with HCN. And I know we did have a couple pilots in there that really helped us hone in and strategize on the data we wanted to collect. So thank you all so much for helping us get this ready to launch. And the attached template has been developed to track your trends in the 340B program and hopefully parallel that financial and operational impact. And then ultimately, I think as a whole, generally support advocacy efforts. So up on this, this screenshot at the bottom here is we wanted to just get a sense of who you are, provide the 340B ID and kind of the contact person to come back to with any questions. And there are 5 points or 5 components to this template. And so each kind of slide as we step through them. We're going to go over the valuable metrics and then we can pause for a couple questions. So before I go into the tool, I'll pause and see if there are any questions as it stands. Okay.
And right now I'm not seeing any questions come through.
Okay, appreciate it. All right. So after the header, that contact detail and all that good stuff, we do have the first question, which really just asks generally, what's your monthly savings? What does your pharmacy contract pharmacy network currently look like? Or your pharmacies in general currently look like? And we have provided a template in a subsequent tab that ties to the number on the template itself. So if you kind of go back and forth between those 2 tabs, the input from the bottom table will feed directly into the calculated net 340B savings per month. And the goal here is to get a sense of the summation of what that total is per month that you're looking at, and then down the line in the next couple questions, we'll tie that to kind of the purpose, the program intent, and how those savings are being used with the program. And if we can just remember this calculated net 340B savings per month as kind of our starting value, that's really what we're going to launch from and then tie the expenses from there. So this is point 1, and we'll just jump to point 2 here. Okay, so now that we know the quantity of savings per month that we're working with, question number 2 asks, what services do you currently provide because of 340B savings from that number 1 total? And we have a drop-down table built in with a couple of drop-down options, but please feel free to select other. We know that 340B savings and kind of how they tie to the intent can be very expansive. So we just wanted to make that other section so you can please allocate your expenses properly as they align with your program. And as these totals come together, we'll kind of calculate and balance out, okay, which expenses tie to that $10,000. Or alternatively, how I like to see it, if the monthly savings were to decrease or disappear, which programs would be first to be cut, or which services would be revoked? So again, number 2 here is really to align the monthly savings with the expenses all under 340B intent. All right, with number 3 on the template is to address the uninsured patient benefit directly. So number 3, what would your uninsured or underinsured patients pay at the pharmacy if they were not given these savings? So here is a couple, it kind of refers to that table up above in the presentation where we took some common medications and just gave a snapshot of what this could mean to the patient. What couldn't they, what medication would they not fill if it wasn't the price it was at this time? So the steps we offer for covered entities on this question when they're kind of compiling of all the drugs that they write prescriptions for, it can be a lot. So we ask to start with the most common medications in your prescribing data. And with that standard day supply in mind, paint the picture of, okay, if this medication weren't offered at 340, patients would be paying, this much out of pocket rather than the estimated 340B cost to the patient. And I think it's these common medications that may help paint that picture and build that narrative. Okay, if 3% of our patients are on cardiovascular meds, or if 3% of our patients are on diabetes medication, kind of multiply that by the cost of the estimated out-of-pocket versus those savings, we're saving our patients, this times 3% of our patients, it can really add up to build that picture and become more impactful if we hone in on the right medications. And then moving to reimbursement rate. So number 4 hones in on discriminatory pricing, or kind of the reduction in trend that we're seeing on discriminatory contracts and reducing reimbursement rates over time. So the question reads, how much have you been impacted as a result of discriminatory pricing? And we gauge this by looking back. We've provided three years worth of kind of plug and play detail. So if you see those 3 years of 340B reimbursement rate, 2020, 2019, and 2018, if you were to feed that data in, it kind of right away integrates into a line graph on the main page to display that reduced payment rate over time. And I think this really demonstrates this culmination of the 340B attacks as we see the trends progress. And I know this might be difficult to assess overall because, price changes occur and drugs move from brand to generic. But I think if we take the data request we have and try to pull out any of the kind of the most expensive drugs that we see, or the most detrimental price changes that we see, or intense fluctuations, and we hone in on just that trend line, we can really capture that slope decrease. Okay, and last but not least, number 5, the manufacturer impact, points directly to the manufacturer threats that we touched on earlier. And we know that these manufacturer threats will have an impact on many covered entities if there's not pressure continue to be put. So we wanted to just relay what the percent of your net savings in table 1, that first starting point, have been generated from NDCs from the following manufacturers. So we list out those manufacturers that have taken a stance, and we may have to modify this for Novartis. But we want to allow this portion of the report to tie the percentage to the actual dollars of savings, with the goal that a covered entity can relate the 340B threats to the services and programs that would be cut in a formulaic way. And we saw this from a pilot client, or a pilot covered entity, excuse me, where that natural extension of the data, that next step, leads itself to say, okay, this loss of revenue impacts our patients this way. So loss of 340B savings of approximately X dollar will cause the elimination of program Y, Z, reduction in salaries to, this physician, this pharmacist. And so we really outlined kind of that quote at the bottom of this slide to really allow you to plug and play based on your impact. So that concludes the steps that we're asking CEs to think through. And to make sure we are comparing apples to apples, as Alex mentioned in the beginning, and when we aggregate this data to best paint the picture of the impact, we are asking that data be sent to HCN's address listed at 340B support. And within the tool, we have the data request as one of the tabs. And we hope that, again, with this data provided, we're able to parallel kind of the benefits in tandem with the loss of savings and just really paint that picture in the communities you serve to be either used to combat this or down the line as advocacy, as those one-pager handouts or whatever you want the use of that to be, and get in front of them with your data. Okay, so I think that concludes the review, the data request, kind of the tabs and what we're looking for. And if you want to get in touch with us, we want to offer 3 levels of support on this, whether it's high-level training on kind of what we can do with this data for advocacy purposes, whether it's a little more detailed assistance in filling out the tool itself, or whether it's in the future with compliance assessments for those annual independent audits that HRSA recommends. We are definitely here to assist in any way we can. And I would like to pass along to see if we have any questions at this time. And if not, I think I'd pass it to Jeff Allen to summarize.
All right. So Brian, you're looking through the question thing. Do we have any questions that have popped up that has been on there?
We do have a few questions. I'm just reading through and trying to summarize. I'll kind of talk through the first one, and then everyone can chime in on kind of what they feel the best answer is, or we may have to kind of revisit this. But the first question is, what considerations have been given to providing info in terms of dollar and cents versus percentage of loss as far as showing our hand with regards to the potential large dollar amounts of savings associated with the 340B program?
That's probably a good advocacy type of question. I don't know if Alex or if you're on, that may be something that, is basically, if I interpret that question correctly, is it a good idea to say, hey, we've lost this amount of millions of dollars, or should we say we've lost 15%? I guess that's the question that is popping up from an advocacy standpoint, which is the best approach. I don't know that I have a strong opinion either way on that. Brian or Ingrid, I don't know if you do as well, but maybe someone from HCN might have an opinion.
I know at NAC, they always say, it's not dollars so much as the percent that it means to your program. So by taking the dollars out when necessary, or when you feel that consideration should be made, by tying it to those programs, especially for advocacy for people who aren't necessarily in the program itself or don't understand the technical component to it, if you say that this has slashed all of our diabetes education efforts. This savings allows us to roll out HIV and AIDS treatment services. Yes, you're obscuring the dollar value of it, but I think that program or that service makes more of an impact than the dollar. But maybe others feel differently.
Yeah, it is, to me, the gross dollar amount, it is possible that could be misconstrued depending on what it is. It's all relative to the size of your entity. And, if you're getting $10 million of savings, but you're putting $9 million back of that into taking care of folks that would have a hard time accessing the healthcare system if it wasn't for you, providing that service, then I don't know that, that's still, you're doing exactly what you're supposed to do. So I think I could see that either one of both sides in that, but that's an interesting question. So Brian, what was the next question?
The other question that we've received is, since the attacks are really geared towards contract pharmacy, the data being requested via this tool should be strictly included as contract pharmacy only. In other words, not including data from our in-house transactions.
And the reason we ask for all is to get a sense of what the percentage is. But right, it does only attack that contract pharmacy branch. I think by capturing all, we can see what piece of the pie it is for your covered entity, as well as, an aggregate.
And I think that plays into our next question around, we don't have a contract pharmacy. Do we still need to complete the questionnaire? And I think from our perspective, it's yes, because we do kind of want to see the big picture of in-house and on the contract pharmacy side, just so that we can have a big picture of total savings. And then Ingrid, I will let you walk through this, because I know that you've completed this for the pilot covered entities. And that question is, how are we calculating savings within the tool?
The savings is kind of all of the pharmacy 340B savings without the that you realize per month minus the cost of the drug. So all of the purchases. So if there are fees assessed, we would hope that you're able to take those out and then do the savings minus the purchases on a monthly basis.
The next question is around specific data about dollars saved is usually kept internal to the FQHC. What will HCN do with our specific dollar data to maintain confidentiality? And I'll try to answer this, and Alex and others feel free to chime in, but I think from our perspective, we're trying to show the big picture of how this impact is going to negatively impact the HCN health centers. So we definitely won't point out health centers at the specific level as we present this data to kind of fight this fight against the manufacturers. And right now that we don't have any additional questions at this point.
All right, well, we definitely, as I kind of give him some closing comments, please feel free to, put your comments in there, ask your questions. There, as with anything, anytime you get a request for information, there may be others that are not on this call that you reach out to ask them to complete portions of this spreadsheet or this tool. If there are questions that pop up, you have our email addresses on the screen. If you could add an E onto mine is actually JEAllen@bkd.com. Sorry, there are like 3 J Allens at BKD, believe it or not. So I have to add my middle initial in there. But other than that, you've got the email addresses there on the screen to reach out to, phone numbers. You can whatever works for you to just reach out and ask. But we really think about the impact that this is not the first time that this program has been under fire. So it is really important to really consider, the changes that might be coming down the pipe. It's important to consider and to have a contingency plan for what would happen if 340B something happens to it. What happens if it gets cut? What happens if it, heaven forbid, goes away? I mean, what would happen to some of these things? It is just important to have a general feel and a general plan. Not that you want to be an alarmist, and not that we think the sky is falling and that it's all happening. I mean, there's lots of great advocacy efforts going on. There's lots of reasons to be positive about what the outcomes might be. But clearly there are challenges to this program, and they keep coming. So in order to really be prepared for this, as you would with any business would be prepared for, if you know that regulation could be changing or that things might happen, that's a significant revenue stream to your health center. It's just good to know, what do we do if this happens? What do we do if our savings gets cut 50%? How do we react to that? And hopefully that never comes to fruition. Certainly BKD, Health Choice Network, NAC, and others are going to do everything they can to make sure that, or try to advocate to hope that that does not occur. But it really is worth your while to really walk through some of these exercises, to have discussions with your board about, hey, there are some threats to this program. Here's what are some ideas, because there would have to be major changes in a lot of health centers if there's major impacts to this. This is just step one of this process. Gathering data, looking at what the impact is to our health centers. This is really just step one. There's going to be several steps in this. And I want to just, on behalf of BKD and all of our advisors, as well as our whole entire community health center team at BKD, I pledge the firm's resources to help you navigate these waters. If there's questions that you have with the tool, if you want to think through strategic planning, anything like that, what we're seeing other health centers do, that what are we seeing across the brotherhood or the sisterhood, what's out there, certainly please don't hesitate to reach out to us. Be happy to jump on a call with you, be happy to kind of think through this. If you're new to the industry and are still not 100% what 340B is and how it works and what that is, there are no dumb questions. You're not alone. There are a lot of people that still don't necessarily 100% understand how this program works, where a phone call to try to discuss this or walk through how it works and how it works on the drug manufacturer side, how those drugs get to you, and how that savings really comes to fruition, which in turn improves your bottom line at the health center, basically, for lack of a better term. So it is important to make sure that we do take this seriously. We look at this tool, we try to do what we can to come up with this data, and then let's look at the impact together. Let's get back in another one of these webinars and kind of walk through the impact of the network members as this tool circulates its way upstream to other NAC and other places, as we really get a feel for nationally, what a true 340B hit would mean to our industry, the industry that we all put our heart and soul in. What would happen to that? And it is good to be able to navigate that. So please don't hesitate to reach out if there's any way that we can help you and help you walk through this tool. Ingrid, Brian, myself, Scott Gold, who couldn't be on the call today but is available as well. Anything that we can do to help, don't hesitate to reach out. Alex, I think I'm going to kick it back over to you for some closing comments if you're there.
So we do have one more question in the chat.
Oh, go ahead. Sure.
It says, for the 2018 and 29 reimbursement rates, can we do it as a whole year and take average?
Ingrid or Brian, that's probably a better question than you would answer.
Okay, and the question one more time is, for the 2018 and 2019 reimbursement rates, can we do it as a whole year and take the average?
I'm just thinking the whole year on average might not exactly paint the most detailed picture, but it would definitely be a start. So I think if it's not, yeah, go ahead.
Yeah, And on the other side of this, especially for 2020 with COVID and the impact, we may see some variation month by month. So I would think, especially for 2020, it becomes that much more important.
I agree.
Okay, that's it. I don't see any other questions in the chat. All right, well, I think that's it. I don't see any other questions in the chat. I don't mind closing out for you all. Did you have any other statements you wanted to make, Jeff, before we wrap up?
No, not necessarily. I just reiterate, please, if any questions at all, don't hesitate to reach out, shoot us an email. We'd be happy to answer those. You just want us to look through the data and help kind of think what it means for your health center, anything that guard, please don't hesitate to ask us.
Okay, and thank you all for joining today's webinar on 340B drug discount program. Questions after the webinar can be sent to those names you did see on the screen there. This webinar has been recorded and both meeting materials and recordings will be made available soon. Thank you again for attending and have a nice evening.